So new bill, new tool, that's something that looks like it could be very helpful in preventing overuses. And I know you gave a quote in the release here. And I'll let you expand on that. That'll help pharmacists get an alert when somebody may be at risk of an overuse based on their prescription history. Yeah. So explain what this legislation is about and how it can really prevent overuse and doctor shopping.
Yeah, really two new tools. One is the Alert Act, which we'll talk about, but I'd love to talk to you as well about a bill of mine that just passed the House last month, the Senior Communities Protection Act, another vital tool in this fight against opioid abuse and addiction. And just to put it into context, last year we lost 72,000 people. The year before we lost 60,000 people. So the problem is getting worse, not better. And there's a lot of reasons for that, and I think we're doing some things at the federal level, and certainly there's a lot going on in states and in local communities and among nonprofits. A lot of people are doing things that I think are helping, and I do expect us to get in front of this. But at the moment, it's getting worse, and there's an increased use of fentanyl in making heroin that's hitting the streets, and that's resulting in a lot of these deaths. Fentanyl is a synthetic opioid, easy to sneak into the country. So back to the Alert Act, which I introduced recently, because we're losing so many people, because people start using heroin and then quickly get addicted, or in most cases, they start using prescription drugs and get addicted and then turn to heroin when they can't get the prescription drugs anymore. We have to do something more to help those that are fulfilling these prescriptions to recognize somebody that might be abusing. And states have done what are called PDMPs, prescription drug monitoring programs, and they're good, and this doesn't replace it, but the problem with these PDMPs is, one, some states do them well and some do them barely at all. Some don't really require doctors to fill out much information on patients, while others require a lot. Some states don't monitor whether pharmacists are really using the information that's available in the prescription drug monitoring program. And states don't really have any uniform way of sharing information, and so people will go across state lines if they're having trouble getting prescriptions filled. In one state, they'll go to the next state. And so what really hit me, Vin, is I was invited to a Hartford insurance company, and I had spent 30 years in insurance, and so really understand how that works. And Hartford's a major payer of workers' compensation claims, about $14 billion a year, and they were mining data using artificial intelligence. They were recording every phone call, and the computer was analyzing just to look for things that might suggest a problem. And then a doctor or a nurse would get involved, and they've been able to help people not get addicted to opioids in the first place. Their prescription use for opioids dropped about 40% after they started doing this work. So they're saving lives. They're getting people back to work more quickly in these workers' comp claims, which is also part of saving lives. It's crystal clear that when people have purpose and have jobs and such, it's one of the things necessary for recovery. And I thought, my goodness, what a model for the country. Every prescription has somebody paying for it, whether it's a private insurance or a government program like Medicare or Medicaid or CHIP, Children's Health Insurance, or VA, or TRICARE, which is active duty military care. All these prescriptions have payers and they have information. And so what my bill does is allows the government to mine all of that, very careful about people's privacy, but it allows artificial intelligence and systems to look at prescription use as it cuts across all of these different systems, and it identifies red flags. And that's really what I want. We've had dozens of outside groups that have endorsed this, because this is key. If pharmacists get a red flag when they put in, somebody's name, and they get a red flag that says, wait a minute, this person has filled prescriptions at different places, different states. It might show doctor shopping. It might show pharmacy shopping. It might show people buying across state lines. It might show people using different programs to pay for them. And these red flags can help pharmacies stop the abuse of drugs. So that's kind of a long answer, Vin, but that's the sum and substance of what I'm trying to do here.
Congressman, how, with this Alert Act and without invading somebody's privacy, do these red flags come up? Is it like an alert in a computer system at the pharmacy?
Yes.
Or with an insurance company that says they're trying to refill a prescription that, maybe they just got a week ago and they shouldn't be, or, maybe they went to CVS and now they're trying to go to Rite Aid and trying to get the same thing filled? Is it like an email alert that gets popped up on the computer screen, or how does that work?
Well, what my bill does is directs the federal government to create the system. So it's, they have, the data is out there, but there's no real way to use it. And I think the federal government's the only entity that can make use of it. So it directs the federal government to do the work of creating the systems, making sure to preserve people's privacy rights. One advantage of using artificial intelligence is it's simply a system looking for patterns and only giving you information when there's a red flag. It doesn't take away a doctor or a pharmacist's ability to prescribe or fill a prescription, but it's giving a warning that, wait a minute, there looks to be a pattern here that's not consistent with proper use of this opioid. It gives a pharmacist an ability to call the doctor again, and it hits the pause button and allows somebody that's filling the prescription to really make sure that there's not a problem. And I think that's the power of it. And I think you can do that. Look, systems analyze data constantly. That's just part of life today. And it can be done in ways that don't violate people's privacy rights. It doesn't create a consolidated record of all their health care. It simply is pulling enough data to say, wait, there's a red flag here. So that's what I want the federal government to do.
So if a pharmacist or an insurance company gets one of these alerts and they see there's an issue, they could really just turn to the patient and say, no, I'm not going to prescribe this to you?
Well, it doesn't. It's the pharmacy that would be at the end of it, and then that pharmacy. I'm not trying to put a computer system between a patient and a doctor. That would be, I think, a poor idea. It simply hits a pause button, and then pharmacists would have to go back to doctors and say, well, look, this flag came up. Are you aware that this person is seeing multiple doctors for the same thing, or seeing doctors across state lines for the same thing? And that gives that doctor a chance to say, hey, you may need some help, and help a person into treatment and recover. And the beauty is, then recovery is possible. We've seen it over and over, that yes, this becomes a disease as people get addicted, but like with many diseases, there's an answer, and that answer is long-term recovery, getting into a continuum of care that helps them get past the most critical phase of stopping the use, and then getting into long-term recovery to deal with the underlying issues, which are so commonly part of this.
With a preventative measure like this, and going off your point about recovery, do you find that with something like the Alert Act here, or something similar, that prevention, if not the number one thing, it could be a very important part of curing this epidemic and helping people find recovery if there are more effective ways of preventing people from overusing prescription pills? Yes, prevention is key, absolutely key, because once somebody is afflicted, once they become addicted to any kind of an opioid, OxyContin, or there's many different opioids. Once they're addicted, it's very difficult to break that cycle. Mm-hmm. And so prevention is key. My other bill, the Senior Communities Protection Act, gets at the same concept of stopping in the first place. There is a enormous problem with Medicare numbers being stolen, seniors' Medicare numbers. And people are engaged in pill dropping, some cases using stolen numbers to fill huge amounts of prescriptions at pharmacies, in this case, that are more, and there's a few of them, but they're critically important. Pharmacies that are actually cooperating with people that are, engaged in the illicit selling of drugs. And it's called pill dumping, and they're, dumping enormous amounts of pills in communities. In some cases,
millions of doses in a fairly small community. Nobody's doing that with goodwill. These are people that are engaged in illicit practices, and my bill allows. It may seem common sense, but the Center for Medicare Services has not been able to stop payment to these pharmacies, until they can prove the case. That can take, years. And so this allows, if there's ample evidence that somebody's engaged in pill dumping or engaged in the use of stolen Medicare numbers, it allows CMS to cut them off while they do their work and prepare the case. And I think this is vital to getting at dealers that are in the guise of reputable businesses.
Does the ALERT Act or the Senior Communities Protection Act in way or maybe go after or help prevent grandkids or kids from raiding their grandparents' medicine cabinets and looking for prescription pills? Is there anything that could be done to prevent some of these people from taking advantage of their own grandparents? Yeah,
sure. It's a great question, and no, that's not the focus, unless that results in somebody going out and filling more prescriptions than they could possibly be using on their own. And then I could see a pharmacist saying, "Hey, wait a minute, this is saying you're filling this too frequently," and maybe that's a red flag that somebody else is misusing the prescription. That's a vital thing, though, and I think people need to be aware that there's a lot of teenagers, a lot of younger people that will say that that's how they got addicted to pills, sneaking pills out of a medicine cabinet. And this is so devastating for a young person to start their life in the throes of addiction, often resulting in a criminal record and just, sending their life on a spiral that's very difficult for them to get out of. And so prevention is key. We have to recognize, though, that we have hundreds of thousands, probably millions, of people that are already struggling, and we need to help them. As a society, we need to help them, and it's definitely in the millions, as I think about it.
Would doctors be able to, and going back to the ALERT Act, be able to talk with each other if they find out that somebody is doctor shopping to get more prescription pills, in addition to the pharmacist or the insurance company reaching out to these doctors? Would doctors share information with each other, saying maybe, he's seeing me for this and you for that, and we've both prescribed him the same type of medicine? Would that doctors working together also help, you think, prevent overuse as well? Would they be able to maybe gear these people toward treatment?
Yes, and I think that's precisely who ought to be talking. And not so much insurance companies. I think we have to be very, very careful about people's privacy when it comes to outside businesses, but doctors that are treating the same patient should be able to communicate with no fear of repercussions. It's one of the things the bill is meant to get at, is to make it clear that doctors that are talking to one another for the benefit of a patient ought to be held harmless they shouldn't be afraid to share information that might save somebody's life. And I had one medical group tell me that the misapplication of privacy issues is one of the great barriers to overcoming this crisis. That people are so afraid of getting sued that they're afraid to do things that actually could save somebody. And so we have to let some common sense prevail here. Doctors, we don't want to get anyone between a doctor and a patient, but we also don't want to let some legal impediment get between doctors collaborating together to save a patient, to save their life and to save their future.
Congressman MacArthur, before I let you go, anything else you want to expand on with the ALERT Act, or anything tied to it that you want to get out there that we maybe didn't touch on yet?
Well, I'll say this. I continue to to be the co-chair of the Bi-Partisan Heroin Task Force. We have a Republican chair and a Democratic chair. We work very closely together, and my Democratic co-chair was a co-sponsor of my ALERT Act. So we collaborate at all turns because we need to solve this problem together. I know that this is bigger than any one of us. It's bigger than any one institution, certainly bigger than any one person or community, but it is not bigger than all of us together. There are far more of us that want to help people heal than those that want to sell drugs on the streets, and we have to get at that too. There's a justice issue here too. We have to stop people that are preying on our children, but there's far more of us, and we're going to win this issue. We are going to overcome with God's help. I honestly believe that this society is good and caring. We're going to provide the treatment that people need, and we're going to get in front of this. And that's what our task force is all about. We passed 50 bills. My Senior Communities Protection Act was one of them. We passed 50 bills in July, all focused on different aspects of the crisis. And we're going to continue to work, and all of them, by the way, were bipartisan. They have to be in our task force. Mm-hmm. Right. And you know, when we're right back at it, as I said, I just introduced this Alert Act, and we're going to start a whole new round of things that will help, and we're going to get in front of this, and we need to do it fast. People listening that have a problem or a family member that has a problem, I would really encourage them in our counties in South Jersey. We have programs that people can walk into a police station and get help. The Blue Heart program in Ocean is a great example where people can walk in and get help and get into treatment. We also have on our website a guide to help people find the resources that can help them. If people are struggling and suffering, there are many of us in the public sector, in government, and I know there are many in the private sector that want to help people to recover, and they should not struggle alone. They should come and get help.
Congressman, thanks again for calling in this morning and sharing the good news about this Alert Act and what it can do and what it could hopefully do sooner rather than later, as soon as the legislation becomes law and everything.
Okay, then I appreciate it.